Thank you very much. So my subject is the prevention and treatment of smoking relapse. First of all, we start with definitions. Sleep or lapse is when we smoke even one cigarette or even one puff for less than 7 days after quitting smoking. It is very important because lapse lead to relapse. As you can see, in 85 to 95% of the cases of lapses, they progress to relapses. So here is the phrase, even one puff is not permitted. Relapse means going back to smoking regularly after a period of abstinence. For research studies, is the smoking of up to 5 cigarettes per day for 5 consecutive days, or smoking even 1 cigarette for more than 7 consecutive days. Here you can see the relapse frequency. The majority of them is in the first 5-10 days. After this period, we have a decreased frequency, but it occurred regularly. Here you can see that during the first year, we have unfortunately 60 to 90% relapses. During the second year, we have 20%. During the second to 6th year, we have 2 to 4, and 10th and more years after quitting, we have again 1% frequency of relapse. The classical model for the relapse include dependency and withdrawal symptoms. But as you can see here, there are many other factors that impact in the procedure of the relapse. So we can disseminate the risk factors into internal factors and external. Internal factors peak, persistence or reappearance of withdrawal symptoms and craving, negative or positive effect. Stressful environment, smoking, use, and alcohol are included in the external factors. Let's see first the internal factors, and first the withdrawal manifestations. Here you can see the most significant and important manifestations: irritability, anger, anxiety, depressed mood, difficulty concentrating, restlessness, increased appetite, and insomnia. And all these manifestations create a so-called withdrawal syndrome. We have, of course, and other manifestations due to the withdrawal. Constipation, for example, dizziness, nightmares, nausea, sore throat, mouth ulcers, and cough and sputum, especially in the first days of the abstinence. Here you can see the severity of withdrawal syndrome. It is peak during the first week and then gradually decreased. But it is not always this picture in reality. We have fluctuations of the severity. In order to use nicotine withdrawal as prognostic factor, we have to assess the severity, the duration, the daily fluctuation, the slope of symptoms related to the time, and the degree of relief with the lapse. Craving is not included always in the withdrawal symptoms because it has a complex origin. It may be a result of nicotine deprivation or a result of withdrawal relief, and it has a tone or phase manifestation. Means a phase manifestation means that there are sometimes a peak of craving, a decrease of day. Significant manifestation on nicotine deprivation, we have a decrease after quitting. It is more intense in the morning, and it is a life experience. This last phrase, it is very well known by the smokers. It is related with smoking use, and it can be used as a relapse prognostic factor. Let's see now the external factors. First of all, the stressful environment, and it is very common in our days. With the stress, we have an increased craving and a decrease of self-control, which leads to the use of reward substances. Smoking use. It is a new factor of the relapse. It is extensively studied during the last decades, and smoking cues are conditioned stimuli formed by repeated pairing with smoking. It was smoking, it triggers relapse. They can differentiate in direct or indirect, such as environment, home, gathering places, smell of tobacco, situations, tobacco availability, movies, and people, smokers. Here you can see a very familiar pictures of smoking cues: cigarettes, friends, bars, gambling, drinking, etc. Alcohol, it has a negative correlation with smoking cessation. It has a high incidence, we have a high incidence of relapses due to alcohol use, and it is a risk factor for sure for relapse, especially in relation with smoking use and negative effect. Here you can see the correlation, the combination of this relapse factor. And you can see that the combination of alcohol consumption with other smokers and negative effect increase tremendously the percentage of smoking relapse, of lapse, and then relapse, of course. Here you can see a very useful slide showing the time course of the risk factors implication. During the first weeks, we have the physiological withdrawal, and the relapses during this period is due to this withdrawal syndrome. Then we have the cure activity, and finally, the obstinance protective factor. So, in the internal factors, of course, we can add the sex, the age, and the severe addiction, and to the external factors, the socio-economical deprivation, which is very familiar during the last decade. How can we prevent relapse? We have to anticipate when lapses are likely to occur and avoid them, and learn to cope with a lapse to prevent relapse. So we have behavioral skills training for the prevention of relapse. We prevent initial lapse and maintain obstinance. We have to identify and eliminate risky situations and triggers, people, places, and things, and physical and emotional triggers. We should say to the smoker to increase time spent in safe activities and context, and we have to help him to cope with relapse to prevent further relapse. For example, we may suggest relaxation techniques, problem-solving skills, and social support. We have also cognitive methods. We have to help to enhance the self-efficacy of the smoker, identify and utilize personal strengths, address giving up, I will always be a smoker, address outcome expectancies, rationalizing smoking. One cigarette won't hurt. It is a common word from the smokers. Fear of failure, beliefs that drug helps problems in life. And of course, we have to have a relapse management plan. Medications is another way to prevent relapse. It is very useful to disseminate the medications into controller and reliever. Such as in asthma. Controller is the nicotinic patches, bupropion, and varenicline. And relievers are the inhaled nicotine gums and sublingual pills. So in order to manage lapses, we use mainly relievers and not controllers. But if we can use controllers also in serious situations. So we have to management the smoking cues, management of internal factors, management of withdrawal symptoms, management of lapses, and we can extend the smoking cessation medication. It has been found that the extension of medication with varenicline and NRTs can prevent the relapse. So how can we manage relapse? First of all, we have to ask why. We have to recognize the risk factors that led to the relapse of the smoking. And of course, we have to repeat the interventions, cognitive behavioral skills, in order to manage these risk factors. We can change or add medication. We can increase dosage if the smoker is on medication. We can change it, and we can add another controller. We can use 2 controllers instead of 1. And finally, we have to have a close contact with the smoker who relapsed, and we have to give him a supporting care. Thank you very much for your attention.